Hi, everyone. Welcome back to Dry Eye Hive, episode number 3. I'm just going to turn this waiting room off so I don't have to babysit it. See some pretty new faces. Welcome, everyone, to a private event. This is very exclusive. It usually costs a couple $100 to get into here per night, but we're opening it up for free.
No.
We're joking. So, all right. All right, welcome everybody. You're more than welcome to and encouraged to turn your camera on. This is going to be a patient-facing side. We're all a bunch of industry professionals, eye doctors, and office managers and administrators. A lot of us are in the pharmaceutical side, and we're here to share our knowledge with you. And it's hard to find, great knowledge, especially some of us we live in less populated areas, and it makes it very hard to, receive care. So we're just going to give it a few more minutes as people trickle in here. So we got a good 18 people on here so far. So welcome everybody. You're more than encouraged to turn your cameras on. It's nice to see everybody. And if you guys want to just put in the chat here, if you wouldn't mind telling us, are you a patient or a doctor? And I'm going to put it in the chat because it would be good for us to know, so we know how to call you. So patient or doctor, or eye care professional, I'll call it, because some of us are not doctors. And then 2, where do you live? So I put the questions in the chat. If you could please just answer those for us. Okay, welcome Leslie from Boulder, Colorado. Awesome. I'm from Kansas. We're just a neighbor, very far away though. All right, welcome Jacob. I saw your comments in the Facebook group. We'll make sure to address those. And I think one of them was, why does insurance not cover dry eye treatments? We will discuss that. We're not politicians. Most of us are not on insurance boards. We're just trying to provide patient care. So we don't control a lot of that stuff. And looks like we have Michelle's back from our Canadian friends. So I know we have Canadian patients that are going to be joining us. So we'll direct them your way, Dr. Barron. Okay, well, welcome everybody. Looks like we got lots of fun stuff here. Patient from Manitoba, Canada. We have all sorts of good stuff. All right. Well, we're going to hop right into this and get going here. My name's Perry Brill. I'm the moderator for tonight, and I'm going to give you a rundown how this works. So this is an event that we host every other Tuesday night for the eye care profession, and it's ophthalmologists and optometrists, and we come on here and talk about dry eye. And the reason we talk about it is because we can read books, we can look at case studies, we can go to conferences all day long. But for us, it's so important to be in the trenches, talk to other physicians that are actually, doing it. And a lot of dry eye care is more than just buying a piece of technology. It's more than just going to school for it. It changes really every day. Every single month, there's a new product on the market, and we're thinking, how can we, implement this? And so generally, we're talking about doctor stuff and business stuff and technical scientific things. But this time we wanted to open it up to patients or, consumers and allow you to talk to other doctors without the need for a copay, with no stipulation of buying anything, no pressure. So that's why we're here tonight. And just to reiterate, you're not going to be sold anything. There's no follow-up emails. We're really here altruistically to help you. So with that being said, I'm going to introduce you to some of our guest doctor panelists. Of course, if there's any other doctors on here that want to answer questions, you're more than welcome to speak up, because this is why we're here. So with that being said, Dad, I'll let you introduce yourself, just where you practice, a little about your dry eye clinic, and then I'll throw it over to you, to Dr. Beck.
Sure. Yes. So I'm sorry, I apologize. My microphone was going off. Go ahead, Ray. Sorry.
Yeah. Raymond Brill. I practice in the heart of America, in what's known as flyover country. So Kansas City, and it's dead center in the middle of the country. And right now it's about 30 degrees outside. It's cold, it's windy. It's a nightmare for dry eye patients. So we've done dry eye in our practice really since about 1983. I mean, but it was very unsophisticated back then. You had a handful of drops, you gave someone a drop and it either worked or it didn't. But our technology and our knowledge has advanced over the years. And it really, up until 2014 is when there was a big inflection point in dry eye. We had research that told us that dry eye didn't mean just you need to make your eye wet. And we learned at that time that it wasn't about adding artificial tears, that it was mostly about oil deficiency in those little glands called the meibomian glands. And at that point, we had adequate studies, we had proof what it was, and the pioneer was Dr. Donald Korb in Boston. And he had some pivotal studies to show that 86% of the time it was about the oil. And at that time, he also developed a piece of equipment called LipiFlow. And that made a dramatic change in the way we approach dry eye. And it's changing almost every minute since. So the patients that we couldn't please before, we now can please. And there are all sorts of other newer technologies that are abound. Some of them I call them kind of fake or just palliative care. But the fact is that most eye doctors in the country do not like dry eye. The surgeons definitely don't like dry eye. And so this is part of our journey, and we're here to help you with your journey. And it's complex. A lot of things we do are very cut and dried, treating infection, removing a foreign body, but dry eye is very, very complex. So it's no surprise that all of you have a different journey. So Ryan, he's in Florida.
Yeah,
he's a smart one. I got a Florida background in the back of me, so.
It's true. It's true. Anytime you want to come visit, you're more than welcome, Ray. So I do practice in Boca Raton, Florida, medical director of a clinic called the Dry Rescue Clinic, as well as the organization. I practice 4 days a week and then do 1 day of administrative work. So I'm in the trenches doing this every single day. And to reiterate some of the things that Ray was saying is that we're finding more and more complexities every day about things that affect the eye, as well as the available treatments for the eye too. So if the doctors that you may have seen in the past who may have given you some frustrations that they have not gotten to the root cause or solved your dry eye with one magic drop that was able to try and fix everything, it's because we're still learning, we're still implementing. And if these doctors had not been as forefront on the research and implementation into their practices, then they might not be providing that highest level of care. Part of what this whole series is about is really to elevate the level of care for all of our partner colleagues so that we can get up to that level and start providing, more and more comprehensive care to our patients. Even today, I had a meeting with a device company that totally changed the way that I was thinking about some of the way we get into eyelid care that is actually really important, as Ray was just saying, about where it's hiding the meibomian glands and the ways that we can alter the treatment, maybe without even touching the eye surface, just to be able to make things better. So, I push, I guess, as a starting point, is to not be afraid to talk to your doctor about what else is out there and ask, what things that we can do or try to be able to make things better, because we're all here to be on this journey together and help make everyone better.
And I would add to that, 20 years ago, 30 years ago, all you needed was a smart doctor. So now you need a smart doctor and you need smart technology. And that's in all aspects of medicine. Just think about what the type of care before we had x-rays and then CT scans and now MRIs. And so if somebody is hamstrung by not having the right technology, often they won't recommend a treatment. But that doesn't mean that everything needs high technology, but you have to be aware that if the doctor doesn't have the proper technology, they may not be able to provide the highest level of care. And they may not refer. So, which is the sad part, because our philosophies say, just do what's right for the patient.
All right. Well, thank you for the intros, doctors. All right. We're going to open it up, get right to the fun part. So we have patients or dry eye sufferers And believe it or not, even us within the profession are dry eye sufferers. I'm young, I work in the profession, I suffer from dry eyes, even with the best technology, all the tools, the data as an eye doctor. So if I would like to open up the floor to any of the patients here, and you can just simply unmute yourself and you can ask us any question. And what I would kind of expect from you is tell us what your diagnosis is, anything you've tried for treating your dry eye, and any frustrations you're having, or just simply any knowledge that you're looking for. So with that being said, feel free to unmute yourself and ask any questions here. I know Jacob, you had some questions, I know, but.
Yeah, I'd be happy to go first if that's
Yeah.
okay.
Yeah. Where are you from, Jacob? Thanks for being here.
I'm originally from Arizona. I'm currently living in Williamsburg, Virginia, to try to get a little bit more humidity for my eyes. So that's.
I was gonna say, yeah, Arizona is the worst dry eye zone to be in. Although there's some great doctors there for dry eye. And what do you do? What do you do for a profession here? Just so we can kind of have some awareness how you use your eyes.
So I work in finance. So I'm staring at a computer screen for a good portion of the day, which may have contributed to my problem, but I've been in finance for probably about 15 years now.
Okay, great. So what's going on? How can we help?
So I guess my question is, I've tried several things. I've actually gone to a pretty well-known dry eye doctor there in Phoenix. I've also gone to one in the Seattle area. And then now that I'm living in Virginia, I've gone to one in DC, since I've kind of lived in different parts of the country. And I was kind of expecting different treatments from different doctors. The first doctor that I saw, I had about 6 different sessions of IPL where they put the shields over my eyelids, and they did not do any expressions. They actually said they didn't believe in expressions. And then I went to a different doctor in Seattle, and I had a different type of IPL there where I had the actual corneal shield within my eye, as well as a zest treatment, which is similar to like a BluffX, and then as well as a LipiFlow procedure. And then recently I've tried IPL again with a different doctor, and I'm trying PRP drops right now. And unfortunately, the PRP drops feel like it's causing my eyes to be more dry.
Oh no.
I'm also on, let's see here, Xydra. If I take Xydra once in the evening, my eyes do feel a little bit better, and I feel like that helps with inflammation. But if I take it twice a day as directed, I feel like my eyes are more dry. And then I would also say that the different types of steroids that I've been prescribed also feel to be more drying on my eye. So the most recent dry eye doctor that I've seen in the DC area, again, recommended, let's do another, 6 rounds of IPL.
Wow.
And I'd be more than willing to do that, but I don't want to just keep doing the same thing that I've already tried, since I feel like I really had no results from the last 8 rounds of IPL that I've done. So curious if I should just go forward with that. My first question to them was, why would I do this again? And their response was, well, you did IPL last time without expression, and IPL without expression is useless. So curious what the doctors would say, like, should I go forward with another round of IPL with expression after each round, or should I try to ask my practitioner for a different type of treatment altogether to see?
So first of all, I want to commend you, first of all, for being brave to come on stage here. So thank you so much, and sharing your story. Also, I would like to commend you for the financial commitment you've made of spending thousands and thousands of dollars to seek treatment. That's something that we're going to hear a lot, is there's a financial burden to dry eye. But I just want to say that, because that's amazing. You've already taken the right steps. So doctors, let's hit this one. Let's have some fun and give Jacob some advice.
Can I ask, what is your diagnosis?
So I've been diagnosed with some ocular rosacea. I've also had seasonal allergies for about the last 5 years as well, that may have contributed to part of this. And then I've had many lipiviews to view my meibomian glands. And most of the glands are still intact, which my first doctor said, your glands look great. I'm surprised you have any symptoms at all. But in all honesty, it's burned and kind of felt like a living hell. So I guess the only diagnosis I've received is MGD, ocular rosacea, but nothing other than that. And I guess dry eye. But the main symptom I'm having now is burning, primarily in the evening. So it progressively gets worse throughout the day.
Did anybody, before they did the LipiFlow, did they do what's called a BlephX, and I'll explain that, or manually debride your lids? So these oil glands, a lot of times what happens, if you have good oil glands, but they're blocked, there might be a membrane covering the oil gland, or just might be a biofilm. And if you do LipiFlow, or they call a thermal vectored pulsation, meaning it's going to heat the inside of the lid to the 108.5 degrees Fahrenheit that it needs to melt the oil. And then it's going to kind of gently massage it to get the oil out. But if there's a blockage, or if there's a membrane covering it, then it wasn't really done correctly. So, and that could be done BlephX, or maybe as a zest treatment, which is a chemical okra-based, and Dr. Pham, who invented that, will be on later on with us. So that had to be done first. So was that done first before you had your LipiFlow?
Yeah, I would say that I've invested in a new lids device to do that at home, but I also had the BlephX procedure done before the LipiFlow as well.
And did you have any staining? Did they say you had any fluorescein or lissamine green staining defects of your cornea?
That was not mentioned.
Okay, so because that we want to separate out what is MGD and what's inflammation. And generally speaking, inflammation will need to be treated by with a steroid. And looking at your face, you don't look too red, but I can't really see your eyelids. It looks like you did not have LASIK, so that's good. And you didn't have your eyelids tattooed, right?
No, definitely not.
Okay, so that's good. All right, so and so how's the quality of your tear film? Did they say anything about the quality of your tear film? I mean, do you have like, your tear, you're very knowledgeable, so that's good. Your tear breakup time, do you know what your tear breakup time is?
So most recently they said that was about 6 seconds for the tear breakup time.
Okay. So, so the burning, I mean, at least it's in the, if it was in the morning, we would think that you might have some eyelid exposure, meaning that you have a gap between your lids, and it may look like there's not a gap, but there may be a bad eyelid seal, SEAL, kind of like when you have the magnet on your refrigerator and you look in the side and it's not fully flush and it's not sealed. So I'm sure you tried all sorts of other over-the-counter drops too. Was there anything that you really liked? Like any oil-based drop, like any of the oil-based runs? Do you know if you had anything that did help you a little bit?
Most of them have been pretty terrible. The one that I thought was somewhat useful was Hilo Forte, from all the different types of drops that I've tried, and I've tried almost everyone.
So,
okay. I'll let Ryan take a.
Sure. So it's interesting, with ocular rosacea, if that is truly the definitive diagnosis, and just in meibomian gland issues in general, there's a difference between structure of the glands and saying that they look great and function. And one of the things that's really important that these doctors look into is how well do those glands function. A couple of things that we do when we test in our clinic about how well they function is using, by Dr. Korb, who invented the LipiFlow device, a gland evaluator to simulate how much pressure a normal blink is, so that it can tell if on just a normal blink you're actually expressing any of that good meibum onto the eye surface in general. And then secondly is also looking at the consistency of that meibum that also comes out. We have a grading scale, basically going from, in layman's terms, from olive oil, which is probably some of the best, down to non-expressible and everywhere in between. And so based on a couple different factors of what's going on inside your body that actually helps you produce some of those good oils that can play a role in your ability to express as well. But something that you said just at the end was kind of put the tingles on a little bit, to say that every drop that you used really didn't do a whole heck of a lot. And in cases like this, I start to think of maybe a little bit deeper, especially when we start to have that pain and burning sensation. Do you recall if anybody did what we call a corneal sensitivity test, at any of your evaluations, either with a cotton swab, or, a piece of floss, or even a fancy device called an anesthesiometer to be able to do?
No, that wasn't done. But basically, all that was done was I was asked if my eyes ever go through a period where they don't hurt. And I said sometimes if they're closed or if it's early in the morning. And as a result of that, the most recent doctor said that they didn't think I had neuropathic pain because of that, but nothing like you're referring to.
Okay. Yeah. So there's, different between neuropathic pain and then neurotrophic pain as well. You could have a reduced cornea sensitivity that could be, kind of contributing to the factor, because say, for example, the signal that's being sent back to your brain to rehydrate and keep the eye as comfortable as possible isn't getting the signal until it's too late, and then it's a very strong signal. Then you're going to have that reverb of the pain and sensitivity going on. And there's actually some medications that can help and fix and repair that pathway as well too. So I'd be curious, maybe on the next evaluation and checking into that. As far as jumping right back into IPL in our clinic, when going for another round of IPL and lipoflow, we're really looking at the telangiectasia of the rosacea, right? If it's too flared up, too impressive, just like Ray was saying, it doesn't look like your eyelids are beat up and red and whole face is all red and everything as well, then it's not really the first thing that we jump to. We start looking at some of the other background processes that, might actually get more to the root cause.
Yeah, so was there a pivotal event that happened that caused your eyes to get dry?
So interestingly, I started doing some hot yoga for a while, just to get in shape, and I was trying to get healthy again. And I got a bunch of sweat in my eyes over a couple of days doing hot yoga, and I thought that it was just going to get better, but it actually got worse shortly after that. And then I was told like ocular rosacea could be triggered by saunas, which is similar to what I would have been involved with in a hot yoga class. So I don't know if that's what would have triggered it. My allergies would have been actually doing really well at that time because it would have been in the middle of the winter, which typically my seasonal allergies are at its best at that point. So other than the hot yoga class, I have no idea what could have triggered it.
Sure.
Well, your hair is very nice. Do you use a lot of other chemicals around your face, or sprays, or anything that you could have as an exogenous reason, as an environmental reason? Because you did mention now, are you doing better with the humidity, extra humidity?
I feel like the humidity has helped a little bit here, yes.
Okay.
And no, I don't put extra chemicals on my face. I try to stay away from that. I do use typically like an OcuSoft lid scrub in the evening, and then usually just wash my face with, I actually use a Zocu Clear or Zocu Scrub.
Zocu foam, maybe?
So I'm gonna
Zocu
interrupt here, Jacob, because we have the inventor of Zocu Scrub, which you just mentioned, Dr. Pham here.
Oh, cool.
Dr. Pham, you're muted.
Hi, Jacob. How are you?
Hey, great. Yeah, I actually like your product. It actually does feel really nice on my lids. So that's
Oh, good. I'm glad to hear it.
We've been chatting with him for about 15 minutes. We're gonna move on in just a minute here, but he's had a lot of stuff, and he's moved to a few different towns, a few different doctors, and he's just trying to figure out, what is that, not magic bullet, but what can make a big, indention and getting some relief.
Got it.
So kind of recapping a little bit, just to get Dr. Pham up to speed. He had done multiple rounds of IPL, a Zest kit treatment, LipiFlow. He'd been trying every drop under the sun, didn't seem to really work for him. and currently has been doing at-home lid debridement with the new lid system. And it's also been using the Xydra once a day because that seems to be feeling best at this point so far. Dealing, it sounds like, with chronic inflammation. Actually, one other question we forgot to ask: did they do Inflammadry MMP9 testing for you when you were doing your dry eye evaluations, Jacob?
Is that when you just kind of stick something in my eyelid? And
yeah, and they like put it. It's almost like a pregnancy test of the.
Yeah. I think Dr. Perriman in Seattle did that. I believe, but I don't know what it's called.
Sure. Yep. Just to verify
Jacob,
that there was inflammation there. Yeah.
I do have a question for you, Jacob. Did they test you for Sjogren's?
So I did have a Sjogren's panel and early Sjogren's panel with nothing detected.
Oh, good.
You take an omega-3 at all, Jacob?
So I tried the PRN omega-3s. I've tried actually, I don't know, 5-6 different types. Right now, I'm trying this Udo's oil, which is a kind of a flaxseed omega-3. So I'm trying that out currently.
Okay.
How long did you try the omega-3s, the PRN or either one of them for?
PRN, I was probably on that for 8 months. I didn't really notice any difference, to be honest.
Also, do you have any other autoimmune diseases or in your family history of that?
I have a brother who has psoriasis. No other autoimmune diseases in my family that I'm aware
No
of.
thyroid conditions?
No.
No. Okay. And for yourself, any major anxiety or depression issues, especially when this all started?
No, I would say I'm probably more of a worrier. I'm anxious overall. I would say that I'm usually somewhat high functioning and not like extremely anxious like other people that I've seen. But I do have a certain level of anxiety.
Yeah, the reason I bring that up is I've just noticed that over my 23 years of doing this, that we were taught in school that anxiety and depression medications were the cause of dry eye, but it seems to be that it's the opposite, because I have a ton of patients with dry eye, especially younger patients with it that have a lot of anxiety, depression issues. And so my hypothesis is that this was this low grade inflammation that's associated with it, hormonal imbalances, et cetera. So that's especially the tough cases that I've had. There seems to be a lot of connection with that. So.
Yeah, so I've never had any anxiety or depression medication. I have taken corticosteroids for allergies in the past, or Zyrtec. So I was curious if that could have caused any drying of my glands. I thought that once I got off of that I wouldn't have that issue because I'm not currently taking anything for allergies.
Are you taking any steroid drops? Because a lot of times people, they might start steroid and then they quit too soon. So what steroid drop are you taking if you've tried any?
For my eyes. So I've tried Isuvus, I've tried the FML drops, and then
How long were you on the Isuvus?
I was probably on that for a week or two. It felt like it was
that wouldn't be enough. Yeah, so the way it's written is for 4 times a day for 2 weeks and then stop, but we never stop a steroid that soon. That's just the way that it was approved. So oftentimes you have to be on a steroid drop for months on a tapering dose. And especially if you have inflammation, because the steroids are pivotal in getting rid of inflammation. But oftentimes it takes a little while to turn around your immune system, and you have to kind of be tapered off slowly on that. And our goal in treatment is to have you do as few things as possible. And the other question I have, did they put you on any low dose doxycycline if they determined rosacea is your major issue?
So actually, I just started Doxy probably about 4 days ago. And then I am also trying out Lotamax ointment now, since it doesn't have as much of a preservative in it. So I just started that last night, actually.
Okay. Well, Dr. Pham?
So were you on the steroid? Did it help during that time you were on the steroids, or it didn't do much of a difference there?
So FML really flared at my eyes really bad when I tried that.
So it made it worse.
Made it worse, in my opinion. And then Isuvus seemed like it was making it worse too after a week and a half, so I stopped it.
And did you have any prior sinus surgery, or you have any sinusitis symptoms?
I have had sinus surgery for a sinus pull-up and a deviated septum. So that's one thing I have done.
So is one eye worse than the other then?
A little bit. So my right eye feels worse, but my left eye has more visual symptoms for whatever reason.
Got it.
So you think you might need to be dilated and irrigated,
Yes.
Dr. Pham?
Yes. Have you ever
Yeah,
had that done?
No, what is this?
Basically, you're going to clear out your lacrimal sac there with the irrigation through the lacrimal system there.
You have probably a buildup of debris in your tear film. And so the tears are supposed to empty into a couple of little canals. And then they go to a common canal, which goes into the lacrimal sac. And Dr. Pham is really the pioneer on this, and actually you were at my office. We had a patient that was a recalcitrant patient, and it's always nice to have a visiting doctor. And so we dilated her puncta, which is a little opening close to the inner corner here, and irrigated with sterile saline. And instantly she said, it's much better. I can't remember her exact words, but it was dramatic. So you got to remember all these, like especially the steroids have particulates in it. They're very fine, but it's a suspension, and you could get a blockage of all that debris in there. And we tell them it usually tastes like poop, right? So so it's going to taste bad once it's done, but it takes just a minute, really. So I'll let Dr. Pham elaborate on that.
Yeah, and then after you answer this, Dr. Pham, I want to respect everyone's time, move on to the next person who has a lot of questions here. So yeah, Dr. Pham, go ahead.
Yeah, so anytime I hear of someone who's been through the whole gamut of treatment for dry eye and there's no improvement, there's really only one spot left that's unaddressed usually, and that has to do with that lacrimal system there, and specifically the lacrimal sac. The issue with the lacrimal sac, of course, is that it's basically a collection chamber for all the things that your eyes make, right? So what does your eye make? It's got microbes, it has proteins, it's got debris, and it collects in this chamber, the lacrimal sac. When you mix microbes, proteins, and debris together, right, you get basically sewage. It's the same type of sewage that forms when you close your mouth, because there's a hollow chamber with a bunch of microbes and proteins and food and whatnot in there, right? And since there's so much of the sewage being produced in the sac there, it's going to go somewhere, and it's going to head back to your tear lake just from a concentration gradient alone. And in anyone that has had prior sinus surgery or has had chronic sinusitis, the outlet for the lacrimal system is usually compromised. And that further decreases the flow out of this lacrimal system. And so this makes this a bad situation even worse. And so I think you probably feel a significant difference with a simple lacrimal irrigation.
Gotcha. And are you the only one that does that, Dr.
Oh,
Pham?
no, I mean, almost anyone can do it. It's a fairly simple procedure. You just, you don't need an anesthetic. It doesn't hurt. And it takes literally, as Dr. Brill said, about 20, 30 seconds to do.
Gotcha. But it would be done by an ophthalmologist or somebody?
Yeah, any eye doctor can do it.
Or optometrist, yep.
And just to let everybody know,
bit of equipment. They have to have just a little bit. You have to have the right things to do it, but
if you're a patient attending this, I'll have resources that I'll email to you guys afterwards, so you don't have to remember all this. And then the recording is also available. All right, thank you so much, Jacob. You're a trooper. Hang in there.
Yeah, thanks everyone.
Hey, okay, next person. Anyone? We have a bunch of questions. I'm going to get to those in a bit, but does anyone just want to come on via video, audio, and share your story, and what can we help you with? Just unmute yourself. I see some names here. Tanya, Ali, so Jessica. I don't know if you guys are patients, but don't be shy. We're here to help. It's okay if you're not as knowledgeable as Jacob. He's done a bunch of self-research.
So I can come on. My name's Jessica.
Hi, Jessica. Where are you from?
So I'm from Colorado.
Okay.
I'm kind of newer to the dry eye situation. It started for me probably 2 summers ago. We were having really bad fires here, and it was like go outside and just smoke. And so my eyes were irritated. I started having issues throughout the winter, and I went to an eye doctor like in February of this past year. I got started on Xiidra eye drops and then did some omega-3s and got a heat pack. The Xiidra was kind of burning on my eyes I used it for a couple of months, mostly like on the skin of my eyelids is where I noticed it. So I eventually discontinued that. But then once summer hit, my eyes started feeling a little bit better. And so I kind of was like, oh, maybe I'm good now. But now since it's been getting colder again, like since probably the last month or two, my eyes have been really dry again. Seems like eye drops almost make it worse. I don't know if it's like it's almost like it's watering down like the oil that is in there. I don't know how to explain that, but so kind of my question is
for you. Sorry to interrupt. Before you developed dry eye, did you see do you wear glasses or contacts or have any exposure to the eye doctor?
No, but I did get LASIK.
Okay.
Yeah,
we're all saying
When was the LASIK done?
that was in 2008. So I did get that done. I hadn't had, my vision actually wasn't super bad when I had the LASIK. So I was not wearing glasses very long before I got it. And then I haven't had a lot of dry eye issues up until like 2 summers ago. But I also do wonder, I know I had heard someone mention about hormonal issues being at play sometimes with dry eye. I know when I had my eyes tested, it was MGD. They said my breakup time was 7 seconds and that my main issue is poor quality of oil. So I'm kind of wondering like what is the cause of poor quality oil and kind of like what's a good guideline for next steps moving forward to really start addressing the irritation and inflammation that's going on.
And just one last question. What's your profession so we kind of know what you're dealing with on a daily basis?
So I am a mom. I also kind of have a blog, so I do spend some time on the computer. But
okay,
it's
cool.
Yeah.
Being a mom's a profession, so we know that.
Did you have a dry eye workup actually or not?
Yeah, I did.
Can you share some of the findings?
Yeah.
Were
it was the doctor said that I had the MGD. She said when I tested, my breakup time was 7 seconds. And she just said basically that I had poor quality oil. She said that my tear production was fine, but just that it was evaporating more quickly than it should.
She didn't have any advanced procedures, or she just started you on drops?
Yeah.
Okay. And then did you have follow-up care? Because a lot of times that's just one visit, but you need to see how you're progressing so you can plot out the rest of the journey. Because if you have bad oil, that should be addressed.
Yeah. And I guess that's kind of where I'm at now is I, was feeling better. And so I thought, well, maybe I'm okay. And now that I'm kind of back to this and realizing that I am going to need more consistent care for a while, I just am kind of wondering if there's like, because I've been reading a lot of information, it sounds like there's a lot of different treatment options, but I'm wondering if there's like a general best plan of action of like things to try next.
Well, if you've seen one, you've seen one. And that's the problem with the dry eye support community. It'd be nice if there was a section where everybody could put their history in there. And it's different if they suffer from rheumatoid arthritis and fibromyalgia and the gut disorders, and they had LASIK, and then that puts things in perspective, because you'll have somebody that say, anybody tried this, and then 5 people say it didn't work, and then 5 people say it worked great. you know, but we don't know what their history is. And there is such a vicious cycle of dry eye that everything's interactive. And that's what makes it so difficult to manage. But in general, if I were to just break it down, there's MGD and there's inflammation, and you have to address both. I approach it by saying, what's the major root cause? If it's inflammation, let's deal with that. But if it's MGD, let's deal with that. And then we'll get at the end, we'll end up in the same place with what we call homeostasis, which means a steady state where it may be, this is the best you can do with the minimum regimen. So do you know if that doctor had the technology? Because as I mentioned before, you need a smart doctor, but you need a smart doctor with smart technology too.
Yeah.
Did she recommend any more advanced treatment than just Xiidra? Because
she didn't at that point. She kind of was just saying, you know, like, try this. Sometimes it'll just go away on its own. Is kind of what I got initially.
Did you do a survey? So one of the first things we have somebody do is we use a speed survey. I'm not sure if Dr. Beck used that, but it's a simple survey of score from 0 to 28. And I would like to know what your score was on that survey if you took it.
I don't think that I did do a survey.
Okay.
So, you know, you brought up an interesting point as well, Jessica, is that some of the doctors who are not kind of pushing the knowledge base and the technology and everything that they have available to them to treat dry eye and ocular surface disease do believe that, you know, dry eye can just go away. And what we're starting to realize as a community of eye care professionals in general is that, you know, dry eye is a chronic issue that can be progressive if left untreated or treated in the wrong way. But it's also a chronic issue that can be easily managed when we get to the right solution for you. So I don't want you to, you know, give up hope and saying, oh, it's always going to be this bad for the rest of my life. It's something along those lines that once we find the right plan for you, it's going to be better. In dealing with the poor meibum, you know, the poor oil content, there's a lot of different causes. You know, could be some things that are going on inflammatory inside the body. It could be diet, could be hormones, could be a lot of different things that all contribute to it. And it's hard to narrow down exactly what the root cause is. But in our practice, we kind of take a look at these meibomian glands and do a a pronged approach to try and get everything the best we can. The main reasons that we see in the office, I would say just in general, that the glands start to dysfunction is A, they're inflamed. If they're inflamed, they're not going to work right. B, if they're obstructed, if they're blocked, they're not going to work right. Or C, if they're not producing the right stuff or enough of it, then they're not going to work right. And so it's important that when we're talking about the gland care is that we're kind of attacking all those three areas. Things that we can do to be anti-inflammatory, reduce the swelling, remove any obstructions that may be almost invisible to the naked eye, some clear membranes that block the flow a little bit, and then doing what we can to improve the production. You know, most commonly we're seeing omega vitamins and nutraceuticals to be able to help that out. There's some new medications that are also on the market that help produce more of the meibum. Interestingly enough, one now is a nasal spray to be able to help you out too, that they may not have, you know, offered as a treatment plan. So all of those aspects can really make a big difference for you. But I think that the way that it sounds is we might need just a little bit deeper look into exactly what's the root cause.
So Jessica, is your symptoms getting worse, or is it stable, or getting better with the Xiidra?
I found that I was getting more irritated with the Xiidra, but then I had stopped that. Summer came and my eyes were improved. And then probably like a month ago, they started feeling like a lot more irritated to the point where it's also like dry. It's like I'm getting headaches too, because my eyes are just so dry that I'm like, have a lot of tension.
So is it worse? You say you have MGD. Is it worse in the morning and at night, or is it worse midday?
It's worse at the end of the day.
End of the day.
Yeah.
Gotcha. Yeah. So
Jessica,
you know what? Go, go ahead.
Oh, sorry. Go ahead, Peter. Yeah.
Oh no! So one thing I always caution about anyone just using a lot of artificial tear is the fact that, it seems like a quick fix, but it's actually something of diminishing return because if you think about it, most of these artificial tears are made of some sort of rehydrating agent, whether it is hyaluronic acid, carboxyl methacrylate, or glycerin. Right? All these products there literally are either alcohol based or polysaccharide-based products there, which really don't evaporate. So it really just, the only thing that evaporate on your eye is water, right? Everything else stays behind. So the more hyaluronic acid-based artificial tear you're using, the more of it just stays in your eye. And if you actually dry out a bottle of hyaluronic acid artificial tear, what you get left at the end of the day is a white powder. Right, and that's literally what's going to be accumulating in your eye as you're using more and more artificial tears. And this is why you often hear patients complain that the more they use artificial tears, the more the symptoms worsen. And that's because all of this is accumulating. And because this hyaluronic acid basically is literally a sump and it's just a collection mesh to capture all of this inflammatory debris that your eye is already making, right? And so it's no wonder that the more you try to use artificial tear, the worse it gets. So if you're going to use a lot of it, at some point one a day, just flush it out with a bunch of saline, so at least you wash a lot of it off there, but don't just keep using it. Because that's what happens a lot of times there. It's the law of diminishing return on artificial replacements.
Okay, thank you. And Jessica, sorry, I was just going to say, so you said you're a mom who also is online a lot. So just lifestyle wise for busy moms, poor sleep so overnight is when our tears will replenish. So if you're getting broken up sleep from your kids, that's going to contribute to it. So poor sleep, hormone changes, if you're breastfeeding right now, that will also contribute to dry eye because you're just losing fluid from your whole body. On the time online, so also staring at screens will make it worse, so breaking that up. If you're a busy, tired mom on the go, drinking lots of caffeine, that's gonna work against you, versus drinking water will help you. So there's just sort of these like red flags from a mom lifestyle that might take a look just to help you feel better. In general, it's not going to fix the underlying issue. You have to deal with those inflammatory factors and what's going on at the base level, but also just, looking at some of the lifestyle changes. So diet, hydration, better sleep if you can get your kids to sleep through the night, breaks from screens as best you can. And then you had mentioned that you're getting, pain around your eye. So again, you have to address the dry eye issue, but there's also a link between, dry eye, headache, pain symptoms, and your eye alignment. And I don't know if Dr. Beck or Dr. Brill have more experience with the neuro lens, but there is, glasses, this special lens on the market that has been helping people who are having these dry eye symptoms. So it might be worthwhile looking at a doctor in your area who offers the neuro lens, and maybe Dr. Beck or Dr. Brill can speak to that.
Yeah, absolutely. So we don't have NeuroLens in our practice, but we were exploring it because I had a patient actually just about a month and a half ago who doesn't have correct eye alignment, and it actually exacerbated after they got cataract surgery. Because with cataract surgery, we're removing one of the triggers that help out with the eye alignment in general, and it tends to worsen if somebody had an underlying problem that wasn't detected, beforehand. And what they felt was they didn't even realize that their eyes weren't aligning on the eye target, but their dry eye had gotten what they complained was 80 to 90% worse than it had ever been. And so me not knowing the full history of this patient, I'm going to tell you, I'm not a perfect doctor. And if anybody claims they're a perfect doctor, they may need to take a step back a little bit. I didn't realize that the patient didn't know that they had this eye alignment issue, that this is not something that was long-standing at this point. So I tried some of this traditional treatments we talked about with Jacob, and basically threw the kitchen sink at this patient. And then 3 months after starting the initial treatment, I went and redid her comprehensive regular eye exam, realigned her eyes and put her in a pair of glasses that gave her the proper alignment, 75% of her symptoms went away. It's crazy how complicated the brain can get sometimes, and how one thing that doesn't seem to be perfectly related actually does cause an impact on another. But when you can identify the link and give you some relief, then it really does make a big difference.
How is eye alignment determined?
I'll chime in there. There is a company that is kind of capitalizing on this, but they really don't have any research. They don't have any objective research. And I've been asking for 4 years on that. So you would ask your doctor to say that check your, what we call your accommodation. That means your focusing ability, and also what we call your convergence ability. Meaning, so if you're looking at like a long way away, your eyes are in a more parallel fashion. But when you go to read, whether at a computer or at a book, they have to converge. And sometimes we have something called convergence insufficiency, meaning, and to crank that in, you over focus, because there's 3 things that are combined. It's your accommodation, your convergence, and your pupils get smaller. So these are kind of part of the mainstay of optometry. You may have somebody that does vision therapy in your area to improve that, or and that could be a long process, 12 or 15 sessions. It may end up costing you several $1,000s, or sometimes just something we call PRISM, PRISM, in the glasses. Usually that would be designed just for your near work, will help. That'll help. The PRISM will kind of put your eyes in a proper place, and it's a lot less expensive, and it's certainly worth a try. Dr. Wagner's is nodding his head. So I would just try and say, to get somebody that really does a lot of binocular work, or you may have to ask them, because everything is so quick anymore, to really say, work on your accommodative and convergence, accommodation and convergence.
Yeah. Jessica, I want to thank you for being here and being on. And to add to that, we have a question from Raquel. It's in the chat that I see. Does this mean vision exercises could help reduce eye strain and therefore dryness?
1,000,000%.
Okay, Dr. Wagner, what's your perspective on that?
Yeah, so I'm kind of with your dad here on NeuroLens. I've asked for research forever as well. And
Nothing.
Once I ask about, because I do tons of binocular accommodative evaluations on kids and adults as well. And I think our profession is not doing enough of binocular accommodative testing every single day. And NeuroLens is just kind of capitalizing on it, as he said. But anyways, the issue is that a lot of times, well, especially now, our screen time has increased immensely. And I tell patients every single day, I'm like, think about it, back 40 years ago, we were working on books and paperwork. And then we moved to desktops, and then we moved to laptops, and then we moved to, now everything's on our watches and our phones. So as everything comes closer and closer and closer to our face, that in turn means that those muscles on the inside of your eyes have to work actually a lot harder to focus, as well as then connected to the muscles on the outside of your eyes. So if you're not measuring that and evaluating how those muscles are working during your examination, you're missing a whole big piece of the puzzle. And as Ryan was stating, that made a huge difference in that patient's life, because it can affect how much you blink, or incomplete blinking. That's another major effect of dry eye, or cause of dry eye, is incomplete blinking, because we're staring at computer screens as we are for the last hour. We just tend not to blink as much. My cousin's a professional musician, and this was 30 years ago, and she had to actually go through blink training to retrain herself how to blink properly, because she was reading 18th notes or 16th notes all the time, speeding hours and hours and hours on music. And so she wasn't blinking properly. And when she did blink, it only blinked halfway. And so that makes our glands not work properly. It's a big vicious circle. So there's a lot of testing that needs, just basically make sure you test for binocular and accommodative evaluation. Jessica, that's the thing you want to ask for, whether you're dealing with dry eye or not. So
I appreciate the perspective there. And when we talk about products and instrumentation and all this stuff, we approach it with skepticism. I think the word is what you see and what you get. You have to do your own analysis on it. Well, Dr. Brill, I think you have a special friend here, Anu. I'll let you introduce her and we'll kind of go through her journey. So
Yes, hello, Anu. And Anu is a very special guest. She used to be, I would say, the lay leader of this dry eye support community until, I don't know, you were kind of asked not to be on there because you didn't support something, but I don't want to get into that. But we also did a podcast with you, what, maybe 3 years ago, Perry? And
probably something like that, yeah.
What? Yeah, so
Something
probably
like
like
that,
3
yeah.
years ago. But Anu has a whole journey. She lives in Canada, but I think your wonderful place is Arizona, right? So come on and
Oh, you're on mute.
unmute yourself and then come on and tell us your story. There you go.
Okay, here we go.
Well, Anu,
My
first of all, you have an interesting background. You want to kind of go through, what you do as a profession, because I think it's, people are going to relate to that. You're in the health and wellness area.
Yeah, so I am a registered nurse, and I always hated ice. Ice still gross me out. And I'm also a counseling therapist. So that's my background, my professional background. But I am a dry eye patient. It seems kind of weird to even say that anymore because I've lived so much of a normal life. When I was asked to be a part of this, I'm like, well, dry eyes, let me see. That was a long time ago now. It was 5 years ago that I started having symptoms. And my symptoms came on really, really suddenly. And I had no idea what was going on. I had never heard of dry eye, although I'd seen an optometrist, well, once a year since I was a kid. And so I went to my local optometrist and, I got the usual, put some hot compresses on, use drops. I tried every over-the-counter drop. I was prescribed some steroid drops and, omega-3s, but none of that worked. And so I started looking at, well, actually the optometrist said, well, maybe you need something like LipiFlow. I'm like, what is LipiFlow? I never heard of such a thing. And so I started looking into it, and I still had not had any kind of assessment, and I didn't have a diagnosis. I didn't know really what was going on. I found myself a dry eye specialist, and that's how I got diagnosed. I had all the proper assessments.
May I ask how did you find a dry eye specialist? What was your research?
Online.
Okay, you just Googled dry eye doctor.
I'm in Canada.
Mm-hmm.
I'm in Canada, so actually we did have, I could have had treatment here, but it was a long wait because back then, 5 years ago, things were really still pretty poor. They have improved a lot. And so there was a long wait here. So then I was traveling to Arizona, my happy place, and I found a dry eye specialist there. And
I think I
that's how I
introduced
got
you, actually.
diagnosed. What's
I think
that?
I actually introduced you to.
Did you?
Yes.
Yeah. So, yeah, and got a diagnosis. Unfortunately, the LipiFlow did not work for me. So that's when I felt very, very desperate and very hopeless because I didn't know what else would help. So I started researching again and found IPL, and then found a doctor who did IPL, and that's how my eyes started getting better. I had really severe MGD, and I have very few glands left. So I'm one of the most, severe cases that my doctor does have as a patient. But I am living a normal life. I hardly think about my eyes. I really don't do anything for treatment. I eat a good diet. I take some supplements. I take care of my mental health because I know that really makes a difference when it comes to my eyes. And okay, I don't use eye drops because I really don't need them. When my glands are functioning, I don't need to put eye drops in. And so, yeah, that's my quick story.
So you've reached homeostasis.
Yeah,
the steady state where things are working.
Yeah, and it's not like, I haven't needed some treatment every so often. I'm very, very worried about my eyes. So I go get my eyes checked really often. And I've needed some additional BlephX and IPL and expression done every so often, but it's on an as needed basis now.
So as far as IPL goes, our protocol is once we have a thorough diagnosis, it's generally related to ocular rosacea. A lot of times you can have mites in your eyes, or what we call Demodex blepharitis, or and these are these little bugs that live in the base of the lashes, and they're actually invisible, but we see, I think they don't have anuses and they poop out on the lashes. So we see debris called collarettes. Now your doctor needs to actually have you look downwards to look at that at the microscope, at the we call it slit lamp. So that's associated with the ocular rosacea. And so you can get a zest treatment, you can get BlephX, you can get IPL. But as far as IPL goes, our protocol is 4 IPL treatments separated by 3 weeks. And after the third one, we will generally either do you have to heat up the eyelids. The IPL does not heat the eyelids. A lot of people think it heats the eyelids. You have to heat up the eyelids separate and either do a manual expression or a lipoflow. Then we have a fourth treatment. Of course, in concomitant with this is anti-inflammatories and nutritional supplements. And then on an ongoing basis, we just say we need to touch up on it at 6 months. So you may have a very nice lawn, but occasionally weeds grow in there and they need ongoing maintenance, kind of like you're supposed to get your teeth cleaned every 6 months. So even if you're the best at that, inflammation rears its ugly head. So that's our general protocol on that. And Jake, if he may be interested in that. So we don't do 8 of them or 6 of them. Not that that might not be needed, but, and generally your doctor should give it as a package. So it's a little less expensive. Because if somebody just wants to do 1 IPL treatment, I mean, that's going to be worthless. It takes a while. And the purpose of the IPL is really to go after the pigment, and it's the pigment in the blood vessels, in the inflammatory blood vessels. We generally think of blood vessels as supplying blood and a necessary basis for oxygen, but these are inflammatory blood vessels. And those things may not be your fault. It may just be your heritage, Northern European heritage. And Ireland, the Scandinavian countries, Germany, and that just may be an inherited part of it. So
Anu, do you,
yeah.
from a kind of emotional perspective, do you have any guidance or from the patient perspective, recommendations? You've been down the journey, you've seen plenty of doctors, you've tried lots of stuff. What would you kind of say about that?
Recommendation to doctors or patients, or
Patients, in terms of the emotional fight you have to go through to, 1, find a good doctor, which is hard, and 2, there's a financial burden to it as well sometimes.
Yeah, and unfortunately that is true, that there are many people who cannot afford the treatments. So I think there's effective treatments, but if you can't afford them, what you going to do? Because from an emotional perspective, it's very difficult. I'm now talking about it kind of in the past, but I was very, very impacted by dry eye, to the point where I was counting how long I would have to live with it. Like how long I would actually have to live anymore. And because it impacts every area of your life. So my recommendation for patients is, yes, find a dry eye specialist, and not just somebody who says they're a dry eye specialist, but somebody who actually has done additional education in it, and has the equipment to diagnose you, and has, various equipment, various ways of treating it, not just one way of treating it.
How would you, from a consumer, let's say I wake up, I'm Jessica, and all of a sudden I have dry eye, I'm a mother. How do I vet someone to be a good doctor from just an online research or phone calls? What steps should we take?
Well, what I would look for is, what are they listing as their treatment methods? If they say, like, I have had some, looked at some online so-called dry eye specialists who say, well, we use, we recommend drops or hot compresses. I'm like, not good enough. might be good enough if you have just, very mild dry eye. But I would look for somebody who has LipiFlow, who has, IPL, who has various ways of, treating dry eye.
I do want to address a little bit of something Anu said. If you tell your friends or even your spouses or significant others that you have dry eye, a lot of times they're like, oh, just take some drops. Shut up, take some drops, quit complaining. And there are patients who do commit suicide over their bad dry eye, and it could be post-refractive surgery. It could be that they're just hopeless. They can't open their eyes, they can't drive, they can't work, and they have a terrible quality of life. And this happens every year. We don't hear about it too much. There was a meteorologist in Detroit a few years ago who had something called a SMILE procedure, and she did commit suicide. Shannon Bream, if you know who she is, she's a Supreme Court reporter, and she does a show on Fox on Sunday. But she has in her book, she describes how dry eye totally messed up her life until she found the right doctors and the right answers. So for somebody with neuropathic pain, there are specialists for neuropathic pain. And it's a real situation. It's not imagined, but the psychiatry of it and the dry eye, it's tied in together. I mean, it's tied in together. So it needs to be respected. It's the Rodney Dangerfield of eye conditions, because people don't have a dry eye, don't really know the impact on their life. And that may be something as a dry eye patient and as dry eye doctors that we have to really be compassionate and kind of hold their hand and say, look, I've got you on this. I'm going to take care of it. I understand it. And it's going to be a journey. It's not going to be one day. I had a person we put on Xiidra, and I said, no, it's going to take a while. As you called me that night, I put one drop in and I'm not all better. I said, did you remember our discussion? So sometimes people don't listen either. And sometimes doctors don't communicate well or compassionately, but it is a genuine lifestyle issue. And I'm sure Dr. Barron sees that, Dr. Pham, Dr. Wagner, and there's other doctors on here. So, so we have to address that part too. It's not, here's your list of things to do, just go do it and come back, or don't come back. Actually, don't come back, right? Because that's why ophthalmologists generally don't want to see dry eye patients. There's no surgery involved. And Dr. Pham's an ophthalmologist, he can confirm. There's no surgery involved generally. And surgery usually makes it worse. And they're just a pain because they always complain and they don't generally get better. And they just want to do another 6-minute cataract surgery. How did I do, Dr. Pham, on disparaging ophthalmology? Did I do pretty good?
Excellent.
So I think as the audience here and patients, as we like to laugh, we like to have fun, with our profession. We're really passionate about it, but we do realize you're suffering, and it's always communication that matters most, and getting kind of closer to you and educating. So, well, thanks for being here, Anu. We'll kind of keep you on. If you want to chime in at all, feel free to. Anyone else here want to give us their case, and we'll kind of give you our feedback? A lot of stuff in the chat is going on. So
How about Connie Galloway?
Sure. Connie, if you're up for a little discussion here, just
unmute yourself.
Unmute yourself. You don't need to be on video if you don't like. All right. Well, while someone's going to volunteer themselves, we'll kind of wait here. This is for you, consumers and patients. This is generally an office visit, and you're going to get your chance to talk to some of the industry specialists here. So, hey, Rodrigo, how are you?
Hey, hello.
You got some good questions in the chat. We really appreciate that. Where are you calling in from?
I'm calling from Brazil.
Brazil.
Whoa.
Amazing. How's your soccer team doing?
Oh,
Football.
I'm not playing soccer.
Okay.
but they're doing well. I'm working in the afternoon, and then I hear people celebrating around me.
What kind of work do you do, Rodrigo?
I'm a software engineer, and I work from home.
Okay. And tell us about your dry eye journey, how you started, what happened, did you have LASIK or anything like that?
No, I started like overnight. I had a corneal erosion, and I didn't know what it was. I started seeking doctors, and then the corneal erosion healed, but the symptoms did not go away. So it took me 6 months to find a dry eye diagnosis in order to measure the tear film and know that it was very short and that all my glands were obstructed. And then I started IPL, and it has been so far almost 4 years journey. And well, I as you can see from my post in the chat, I got recently a diagnosis of Demodex after going to more than 20 different doctors saying that I do not have Demodex.
Wow.
There's nothing that can be done. Like I've tried tacrolimus, I've tried so many steroids, IPL, LipiFlow, blepharospine. I have blepharospine here at home. And nothing really improves, but I have those clear symptoms of Demodex. I have this Demodex diagnosis from a single doctor well, apparently, as I was saying in the chat, apparently the only alternative is to wait for the lotilaner new medication, because as I said, I've tried tea tree oil, I've tried IPL so many times. I've tried even the Solantra on eyelids once a week, according to a South Korean study. And I still have the bubbly foam in the tear film. I have the grittiness. The eyelids are super veiny and inflamed. I feel like the eyelids themselves, they bother me more than the eyes, even though my T-boot is just 3 seconds.
Dr. Pham, do you want to?
So is there a history of rosacea here, Rodrigo? And have they done anything to confirm the Demodex? Did they pull out some lashes? Or how did they confirm the Demodex on you?
So the way Demodex was confirmed was that, as I said, the foam in the eyelids, and given that I wash my eyelids every day, it's not very clear, the colorets, but like when I have a microscope camera that I use to record a video, and when I'm zooming very close, I can see that like there is a layer of skin on top of my skin. You know, it's hard to describe. Sorry, but Dr. Perman diagnosed me with Demodex. I really don't know all the details of how she diagnosed me, but she said it was very clear, despite it not being super obvious.
And is it itchy, or is it just irritated?
It's a little itchy. Sometimes it's a little itchy, but it's very irritated like all the time. And every time I wash, it's usually I wake up and then I wash my eyelids. It's fine for a few hours, and then it starts getting gritty, and then I wash again, and then I get so much relief from washing that it's incredible. And then, well, it's really related to washing. That's the only way I can get some relief from the grittiness and stinging.
Yeah, that's an unusual type of presentation for Demodex, where washing helps for hours like that.
Oh, I really don't know what to say. I wash and then I feel better afterwards.
Even just washing with water helps. No need for any sort of soap or tea tree oil or hypochlorous acid or anything like that.
It helps a bit, but it really needs to be something soapy to remove the debris, like oil, that like leftover oil and you know, the biofilm that resides on the eyelid margin. So I really need to wash it kind of frequently, like 2 or 3 times a day.
Is your scalp flaky too? Is your scalp also kind of flaky? And
no, not anymore.
It used to be.
It used to be, yeah. I used to have seborrheic dermatitis.
Yeah, that's what I'm getting at, is the fact that you may still have seborrheic dermatitis here.
But I've treated it in the sense of it's much better than it was before, because I had a lot of discoloration on face and on the scalp. and using the shampoos every other day. The face looks good aside from acne, but I do not have discoloration anymore. But I do have very oily skin, very extremely oily skin.
Yeah, this sounds more like a seborrheic dermatitis issue around your lids more than anything here, more than a Demodex issue there. So maybe you want to start treating it more aggressively with the seborrheic dermatitis treatment on your lids.
Have you tried the hypochlorous acid, Rodrigo?
Yes, I've tried hypochlorous acid.
Does that give you relief or not really?
No, it did not help at all. And regarding the seborrheic dermatitis treatment, I really don't know how much more aggressive I could go, because I reached to such a point that I didn't see any improvement. And then just I dialed it down a bit to using every other day, because I really felt no difference other than the eyes themselves, which were there, no improvement. But the skin is fine.
Let me chime in here. How are your eyebrows? Are your eyebrows flaky at all?
No.
Okay, so everybody's waiting for a certain drug for Demodex. And interesting enough, I've used this probably for the last 30 years as an unofficial treatment. And it's inexpensive and accessible. So that's nice, isn't it, for a change? And but do you have access to a type of shampoo? We call it Selsun Blue, or it's a selenium sulfide shampoo. I'm sure you probably do. Okay, so selenium sulfide has some nice properties on skin, and I have to use that maybe a couple of times a week just in the shower, and I do it with a spinning little brush that is like a Clarisonic. I mean, there's all sorts of those. Women know more about that than I do, but generally put a little bit on that, and it's a spinning brush. Do it on, you could do it on your face. You can, I would be careful right on the eyelids, you know, right where your lashes are, but you can get on the lid, but be careful not getting your eye, because it's shampoo and it's going to sting. So there is an agent that's not been approved yet, but it has a selenium sulfide basis to it. And I think their claim is that it's going to be an anti-Demodex drop. But you have access to that just over the counter. Again, all our information here, we didn't really emphasize the disclaimer, but we're trying to help everybody and give general advice, but you always want to check in with your local docs. You know, but who's going to recommend a shampoo for you that probably costs $4? So what do you think of that, Dr. Pham? Would that work a little bit on his?
Yeah, it should. Yeah.
Yeah.
Definitely try
So
some
try
of these.
that. I mean, try that. And that's an easy answer. And you may be actually cleaning too much. I mean, we have to have some natural oils there. So I think all of us are using tea tree oil much less. Dr. Pham has wonderful products. I don't know if, can you get those in online from you?
In Brazil, I don't know. I don't think it's available in Brazil right now.
Okay, so he has wonderful products that have an okra basis to them, and mainly 3 products. Probably the easiest one to use would be the wipes called Zocu wipes, ZOCU wipes, and then there's a gel, Zocu gel, and then I always get the name. Let's see, or maybe it's not Zocu gel. Right? We always call it Zocu gel.
The shield, Zocu
Shield.
Zocu
Shield.
Shield.
Yeah.
It should be gel. Zocu Shield. And then, so those are the 3 products that he has, but they work wonders on Demodex also. And even for people that have bumps in their lids called chalazion, they will resolve. Professionally, it's done as a treatment called Zest, but I think you're in Brazil. I don't know. Do you have any customers in Brazil, Dr. Pham?
No, we're not distributing in Brazil yet. That's our goal for next year.
But you can order it from Dr. Pham's website. We're not trying to sell things here, but he has a wonderful, unique product, and that may be something for you to try also.
Yeah, I'll look it up. I may be able to import it. I've imported a lot of stuff so far, and I may be able to import that as well.
Just
a quick question on the selenium sulfide. I had heard about that, but I was wondering if it would make the skin, like I've heard it makes the skin more oily. Is a substance, this is a specific shampoo that makes the skin more oily. Is that
I don't think so.
In your experience? Have you
No.
observed it? No? Oh, cool.
No.
Great.
It's a menthol. It has a menthol to it, and that also acts somewhat as an analgesic, as does Dr. Pham's product, the Zaki Shield, and has a little bit of an analgesic to it, which is kind of nice to have a little bit of a pain remediation just from a topical product. But so we have some unique uses here, and I think the easiest drugs to get approved are ones that have already been used, but in different manner. So so there's going to be a big splash when the selenium sulfide based drop comes to market, but I think you could do it. You could kind of so-called bushwhack it yourself a little bit in advance.
One other question for you, Rodrigo. I know you had mentioned you had been through a number of the IPL treatments. Had you ever had any of the low-level light therapy treatments for your practice?
No.
Okay, so
No level one.
so there's and maybe you've come across this in research because it sounds like you're fairly well versed in you know, the diagnoses, but low-level light therapy is a really nice adjunct sometimes to IPL therapy. Instead of having intense pulses of light to help destroy the Demodex, it's more of a consistent low energy of the photons of light set at different wavelengths for different uses. And specifically in a Demodex or inflammatory related case, the blue wavelengths that are associated with low level light therapy in a couple of sessions also might be really beneficial. And because they're not as intense light and, you know, potentially as harmful to the skin and the surrounding tissue, might be easily repeatable if we get to see some good results. Most of my patients who suffer from this and are intolerable for IPL for a number of reasons do fairly well with, you know, 4 or 5 sessions of the low level light therapy to be able to continue.
Great to hear that it has been working great. In a lot of people are seeing results. I haven't been able to find a doctor here in Brazil that does that yet.
Okay, understood.
It's very new.
Thank you for being here. Oh, do you have anything else to add, Dr. Beck?
Oh no, I was just gonna say, I guess I'm gonna have to do a pop-up clinic in Brazil. You know, I'm gonna tell my wife we're gonna go on vacation for a little bit.
Hey, I want to ask Dr. Alain Desjardins, who's from Canada and a good friend of mine, and a very, very knowledgeable, although he's a little shy. If he wants to chime in, you don't have to get on camera, but you want to chime in on any of this stuff, Dr. Desjardins? He's got a nice little comic picture there.
Everyone speaks French here too, Alon, if you wanted to do that.
Yeah, you can speak French or Portuguese if you want, right? Okay, he may be shy.
Sounds good. Well, thanks for being here, Rodrigo. We'll probably do more.
Okay,
of
I
these.
can speak a little
Elaine.
bit.
Oh,
Okay,
hi,
Elaine.
Welcome.
I had to remove my CPAP.
Oh, are you sleeping? Are you sleeping? Okay.
Yeah.
Doctors don't sleep.
For the I forgot the name of the gentleman in Brazil, but
Rodrigo.
Rodrigo. Okay. I'm back from Milan. I was at the big ophthalmology conference there every year, but it's not in Milan. It's at different cities in Europe. And an instrument that's really picking up down there is called the jet plasma pen. And it's starting to be popular in South America as well. It's a total, in fact, I think it's the missing link right now. It kills Demodex. It's got some anti-inflammatory properties and also will unplug the glands at the orifice. You don't have to do any probing. So maybe you'd like to have a look at that. It's called Jet Plasma Pen. It's extremely popular, especially in Spain. I was talking to Dr. Lapuente, who's in Barcelona, and he stopped almost doing IPL altogether. He's so successful with this that it's worth a look. There's a lot of videos already on the internet, and I even went with a small group using it at a dinner in Milan, and we chatted, and it was really interesting. And very, very soon it's going to be Health Canada approved, and I think it's on the verge of being FDA approved as well. Obviously, usage is off-label, because it's not meant for that. It's meant for other purposes. But you should have a look. It's called Jet Plasma Pen. It's a totally different way of treating dry eyes altogether.
How does it work?
Well, you apply it, it's a probe, and you apply it on the eyelid on the inside, and it kinds of milk the glands, but also it's anti-Demodex because plasma is kind of an electric current, so it will basically kill Demodex. And also it's got the property of unplugging the glands at the orifice if there's fibrosis or anything else. So like I said, Dr. Lapuente was in Barcelona, was a dry eye specialist, used to use IPL, and that I was aware of that. But the first time I heard about this is because of him 2 years ago. He did a lecture in Paris at a dry eye conference, and he said at the time that he stopped using IPL altogether, almost 80%.
So is it like RF?
Pardon me?
How does it differ from RF radiofrequency treatment?
It's not radio frequency at all. Plasma is there's different way of using plasma. Like this instrument has a probe, and the probe that we use for the eyelids, it's a probe that you apply right on the eyelids. But you can also have a probe. You can do blepharoplasty with that. You can do a surgery on eyelids to basically lift the eyelids, if you will, some kind of surgery to get it's minimally invasive. And
so you're not actually doing like a mask and probe. You're not sticking a probe inside the oil gland. You're just resting it on the line of marks or the eyelid margin.
You can do it on the from what I've seen. It's applied on the inside of the eyelid, on the tarsal conjunctiva.
And would that be something that optometrists would have to seek extra privileges for, or
I don't think so.
Dr. Beckett, sounds like you are just bringing this into your Florida clinic.
Yes, it's true. So we actually got turned on to the plasma pen technology from Dr. Perriman at her clinic in Seattle. She had done a poster on it as regarding using the plasma technology for conjunctival chalasis, which is essentially the loosening or floppiness of that thin, clear conjunctiva tissue right on top of the surface of the eye. And so in addition to that treatment, because it also had the beneficial effect of being able to do a non-surgical blepharoplasty or lid lift, as well as fry some of the Demodex throughout the process, we thought it was a nice tool for us to be able to add in that could accomplish multiple different things. Just even coming back to the blepharoplasty side of things, that's one of the areas that I think is maybe underdiagnosed about how effective it can be to help out with meibomian gland related problems when we start talking about closure and expression. If patients, as we age and the skin starts to sag a little bit and fat pads start to grow, that we're not getting as tight of a lid seal, then we're not actually squeezing those muscles that surround the meibomian glands and forcefully expressing the good stuff onto the surface. And so just by having those lids tighter and actually being able to blink stronger like we did when we were kids, then we actually get a lot of relief as well. So we're actually just setting up the training for it. I can't speak to it 100% of the way yet. So we're going to have it implemented hopefully before the end of the year, but hopefully maybe by our January sessions of Dry Eye Hive, I can provide some real world examples and maybe even show you some patient photos about how well it's working.
Is it approved yet or in the US or not?
So it's not approved for the conjunctival chalasis treatments yet. Right. I think it's the plasma pen technology is approved for aesthetics treatment. I think they're working on their FDA approval for for the eye related procedures.
And will the Florida board have to say something about that, or is it?
So I spoke with the Florida board. The Florida board actually considers it in the same realm as IPL because the technology of the plasma is essentially what it's doing is it's ionizing the interstitial water It's not acting directly on the tissue. It's not causing any, breakages to the tissue. It's not doing a surgery. It's really just causing a thermal indent underneath the skin, and then stimulating your body's own ability to heal and create the collagen.
So,
But the brand of IPL that I'm talking about is a different type, because it also has a probe that you can apply right on the eyelid. The one that you're talking about that I'm aware of, it's like a current. It's not a contact right on the eyelid. It's like a current that comes from that probe that's a few millimeter away from the eyelid. And the one that I'm talking about, in fact, it's made in the Czech Republic, is used completely differently to treat dry eyes. It doesn't have any effect on the eyelids as far as, making it improving blink or anything like that. It's just its effect is right on the meibomian gland.
That's incredible. Yeah, that's impressive. And I
What's the brand?
I want to move on.
What's the brand, Elaine? What's the brand?
But if that gentleman from Brazil wants to make a search on the internet, I know there are some studies right now being performed in South America. I'm not sure about Brazil, but I know because it's other countries are Spanish speaking countries, and it's so popular in Europe, in Spain especially. I think that's why it's getting some more popularity in South America. But I've heard even lately that Dr. Del Castillo, who's in Spain as well, and he's part of TFOS, has bought one. So that speaks for itself.
Okay. Thanks for being on here, Elaine. We'll have to probe you later to come on and speak. So, all right, Dr. We're going to go rapid fire here. I'm sure some people are getting tired, so I just want to address some questions here. Dr. Pham, Tanya Friesen wants to know, how long does it take for chalazions to go away with Zocular products? And maybe you can share, what is a chalazion?
Yeah, so, we hear this term, chalazion, hordeolum, styes, bandy about there. There's a lot of confusion there, but basically, hordeolums are inflamed tissue on the eye. It's either anterior, which case is a stye, or posterior, in which case is a inflamed posterior chalazion, so to speak there. But most chalazion, when they're in the acute phase, mean it's mainly an inflammatory disorder there. I know a lot of folks like to put heavy antibiotics on these things there, but it's really an inflammatory process there, and you should treat the inflammation. So if you treat that, it usually takes between 5 to 10 days for it to calm down.
Okay, sounds good. I'm going to see if we have any more other questions that we didn't get to from the beginning.
Does anybody else actually want to go on stage here?
Yeah.
With questions?
While I read, you can.
Just unmute yourself and you've got the floor.
Hey, I'll go.
Yeah. Hi, Tanya. Where are you from?
Steinbach, Manitoba.
Okay.
Really
fantastic. Well, welcome.
3 Canadians at least, so that's good.
Yeah.
Yeah, maybe you guys can all get dinner and talk to dry eye.
Yeah, they're my neighbors,
Yeah. All right, what's going on? How can we help you?
So in 2019, I started to get chalazions, and they were like really hard bumps on my eyelids. Like they didn't start out as styes. And the eye doctors here, like it's a small town, so they didn't know really what was going on. And so I, eventually got to the city, and it only started out in one eye, and then like a month later, the other. And I saw an ophthalmologist, and he started me on azithromycin for a month, and then Doxy, and then got LipiFlow, and did all the heat mask and cleansers and all that. And yeah, now it's been 3 years. I'm getting RF treatments, and just started IPL. It's called Eye IPL. And so the diagnosis, they don't like nobody really knows, but they say ocular rosacea a lot. So my question is like, what is the defining characteristic of ocular rosacea that blepharitis doesn't have?
Who's gonna answer that?
So, so blepharitis is a really general term. It just literally means inflammation of the eyelid, right? I mean, you could get an eye infection, you call it blepharitis if you like there. A lot of people like to associate blepharitis with the blepharitis dry eye there. But rosacea is an inflammatory disorder mainly coming from excess blood vessels there. So what you often get in association with this inflammatory blood vessel disorder here is a high association between 60 to 90% association between ocular rosacea and Demodex. And that's one of the hardest things to treat with rosacea. This may explain why you keep getting this recurrence of the chalazions here. It's the fact that there may be an underlying ocular rosacea with Demodex infestation along with this here. And because you're getting all the classic excellent care for this disorder there, it explains why you're not getting recurrences of the chalazions now with radio frequency, IPL, lid scrubs, and all of that.
Yeah, like if I stop the heat masks, they will come back like right away. And if I stop, like the main thing, like the most concerning symptom, I guess, that I have is when I wake up in the morning, my eyelids are swollen. Like it looks really, really scary. And Doxy calms that down to like halfway, but I can't stop Doxy. Like
how much are you taking, 25 or 50 milligrams?
100.
You can probably cut it down and you wouldn't get much worse.
No, I tried to do 250 and it like blew up.
Oh, really? Wow, that's unusual.
Yes, it is. So
100 once a day, or
just once a day. Yeah,
100 once a day. So that's like 250 milligram, which we start that out for the first 2 months and then taper to 50. But you have to stay at that level.
Yeah, after like a year on it, I went to 50 thinking I could, go to a lower dose, but it immediately, like after 2 days, it was really bad again. So
does the diet play a huge role for you when you change diet, like were you on vacation or something?
No, I've tried a lot of different switching up foods and stuff like that, and it didn't change anything.
Have you tried taking a Z-Pack? Do you guys have that in Canada? A zithromycin pack?
Yeah, that's what my ophthalmologist gave to me at first, and that worked really well too. So
we generally do that maybe 1 week out of the month if somebody's intolerant of the Doxy.
So just do zithromycin 1 week and then Doxy the other 3 weeks?
No, just zithromycin 1 week, and then wait 3 weeks and do the next 1 week.
Okay.
The next month.
So 1 week on and 3 weeks off.
Yeah, you could try that, but the Doxy seems to be working. I mean, I don't think there's at that dosage level, it ceases to be an antibiotic, and it's just anti-inflammatory.
At 100, yeah.
At 50 twice a day or 100 once a day, it's just anti-inflammatory. And there may be. Do you have any effect on your microbiome at all?
Not yet, but it is a concern that I have for the future. So that's why I was wondering, if there's alternatives to Doxy and what those were, and you
might have to take some prebiotics or probiotics to make sure your gut health is maintained. But Dr. Pam, I don't think there's a long-term side effect from that, is there? And maybe if you're pregnant or anything, might be a consideration.
No, never. No.
Okay.
So how many sessions of IPL have you had, Tanya?
I had, my eye doctor is doing an IPL trial right now, so I'm one of the trial patients. Last summer I did 4 sessions and I've had 2 so far, and tomorrow I'm going for my 3rd. And I didn't see any difference last summer. I'm not really seeing any difference now. I'm also getting RF treatments every 6 months, and that when they do that, they express the glands, and they said that when my first time getting RF, it was really bad, and now it's good. But
is it around your eyes or on your eyelids, or where are you getting the RF treatment?
Yeah, they put eyelid shields in and they do the whole lids. Yeah.
Okay.
So I just don't know where this came from. Like, woke up one day and it was just swelling and chalazions, and now it's
No eyelid tattooing.
no.
And it's always the upper lid or the lower lids as well.
The lower lids too, but mostly the upper.
But no surgeries before.
There's no surgeries. I did have chalazion surgery, like to get them removed and biopsied when they were really bad. Like both lids were full of chalazions. Like there wasn't even a space of normal skin. Like most people get like one or two, I like full lids. So we did get them removed, and they just came back right after. And so I got a new heat mask. It's like the USB heat mask, and I used that twice a day for 20 minutes, and that's kept them at bay.
So it hasn't come back for 3 years, you said then, right?
The chalazions,
Yes, chalazions.
They've been kind of mostly gone for 6 months, I'll say. Like it took a long time with the heat mask and doing it diligently to get them at bay. So
Are you an eye rubber?
no, not at all. I do not touch my eyes. Yeah.
Well, I saw you moving your hair back, and I didn't know if that ends up being hair, eyes, because a lot of people do eye rubbing unconsciously.
Yeah.
And okay, good.
Yeah.
Well, sounds like you're getting very good care. So congratulations to your team to get it under control. Anybody else have any contribution with that, or?
Yeah, as I was starting to actually kind of mention in the chat, I was talking with Jacob and Leslie there on the text too, is that with rosacea, if it's definitely the true diagnosis that goes in there, rosacea being an inflammatory condition, when we add heat to inflammation, it's not the favorite thing to be able to do, right? Because you get a bruise, you're not going to go put a hot pack on it to make it even better. But it is great for the meibum in general, so we have to be really careful about the heat. I've had a couple patients who've had the chronic chalazia like yourself, that where the more IPL treatments but spaced out over a period of time has really helped out with preventing the re-onset of those as well. Coming to mind, actually, I had a by the time I saw her, 17-year-old patient. She'd been getting chronic chalazion since she was 13 years old, had been through doxycycline, steroid injections as well, to be able to treat them. And she was getting about 3 or 4 a month for that amount of time. And then after we had gone through 8 IPL sessions, the first 4 were 2 weeks apart, and then the second 4 were 1 month apart afterwards. She's now been free and clear of them for about a year and a half at this point. And her regimen is with her proper dietary supplementation, and then the ocular products from Dr. Pham to help keep some of the Demodex portion and inflammation at bay. But I think that healing the glands first using these therapies, I think, is probably doing a wonder for you and continuing to slowly get better over time. And hopefully, if we can start to ramp down on the heat a little bit, then I think that you might actually see the improvement if it doesn't exacerbate too much too quickly.
Yeah, that was the one thing where it's like how do I break that cycle with it's inflamed, I'm putting heat on it, but I need to put the heat on it to get the chalazions down, and I don't know how to get out of that really. So every time I try to stop the heat, I can notice them coming back right away. So but I just started IPL, so hopefully that'll help.
Keep us posted after can message Perry. We can obviously bring it back up as I revisit the case at a future session to say, look, in the next month or two out, now you've had a couple more sessions of IPL. Did it really make the benefit that we all really hope it would? Because we like to share the success stories to our fellow colleagues as well, and why we're getting into this.
Yeah, what I would really like is the eyelid swelling in the morning to go down. Like that's the main thing.
Is it tender when it's swollen, or it's just swelling on the upper lid or lower lid, or?
Mostly the upper lids. It is not tender. Whenever I show people pictures, they're like, "Oh my god," and they're like, "Does it hurt?" And I said, "No, like I would not feel it at all." And which I'm really lucky, because I know a lot of people have a lot of pain out there, but I don't have any pain.
But the minute you put heat on,
cold therapy.
I tried that. That made it so much worse. I don't know why. It doesn't make any sense, but yeah.
For the swelling, okay.
Yeah.
And then
sorry,
just out of
Dr.
curiosity, I apologize, I may have missed this in talking about your history. You've been through this before. Are you using a sleep mask at all as well too?
Like just a sleep mask like over my eyes for sleep?
Yeah, so there's some specific ones that are really helpful for dry eye related issues. Some that create a moisture chamber that actually trap the moisture around the eyes as well. And there's actually some that actually help basically adhesive and form a better lid seal to be able to keep it compressed throughout the night, so that if in case the Demodex or the exposure is adding to the problem, it might be able to be an additive to make it
Okay, so you can use that stuff for more than just people who sleep with their eyes half open type of thing.
Yeah, it could be benefit, or even just because of the inflammation. When your eyes are inflamed, they may not want to close all the way, and so you might have a secondary non-lid closure because of it too.
I did ask my eye doctor to check for that with like the light or whatever they do to check for that. She's like, no, you're closing your eyes all the way, she said. So I never bothered with the heat mask. But
have you had any surgery on your face before?
Nope.
No. And they don't think this is some sort of like lymphedema around your lids?
What do you mean?
Just like excess lymph fluid that builds up around the eyelids there. They don't think that's...
That's what another question I had is, how do you tell when it's that type of swelling or when it's the other type of swelling?
Inflammatory swelling is usually associated with tenderness, whereas lymph swelling usually is not tender. This is why I'm asking.
Right. No, I've never...
Have you tried taking a water pill? Just a low dose water pill. It would have to be prescribed, but and you don't have to take it every day, but sometimes, we accumulate water. And does it vary with your cycle at all, with your menstrual cycle, or no?
Sometimes I think it does, but I'm not totally sure.
Okay. So maybe a common one is a hydrochlorothiazide, where very inexpensive, and maybe you can have your physician prescribe that just to try. So you may pee it all out in one day. So
what does it do exactly?
It will
go ahead, Tom.
It will let you drain some of that excess fluid. So, and let's say if you eat a real salty meal, it's possible that you will retain a lot of fluid. So you may watch your salt intake. But let's say some people just accumulate fluid, they just don't pass the fluid as well, and that lymph could possibly be drained by just a trial of a hydrochlorothiazide oral medication. What do you think of that, Dr. Pham? As a trial?
I'm not sure that's going to help too much there, but what makes this, as Dr. Beck pointed out, that this is an unusual finding where you find that the heat helps, but yet there seems to be quite a bit of evidence for rosacea in this case here. This swelling here is often, this lymphedema is often associated with rosacea as well. And so, you get this yin yang of different conflicting symptoms and clinical signs here. And so, I guess only time is going to be able to tell us what's what here.
There are some also techniques to remove edema, and you might look those up online. There are special nurses that also work with edema removal. Usually it's from the legs, but you might look into what exercises that you might do physically, just like physical massage to get some of that edema to drain. I'm not an expert on that, but I think the information should be readily available.
Cool. Well, Tanya, thanks for being here and sharing your efforts. We really appreciate it.
Thanks. Super nervous.
No, you did great. So hopefully it's less nerve-wracking to come on here in the future if we do these. We're gonna wrap up here shortly, but I'm just gonna rapid fire go ask some questions here, and one of the doctors here will answer it. This comes from Regita Roba. How to make a difference if red inflamed capillaries in eyes are because of dry eye and irritation or because of ocular rosacea?
Is the white part red? Is that what we're speaking about?
We'll wait for a chat comment here, or feel free to unmute yourself.
Brigitte, you could come on. You could come on. It's okay. You don't have to show your face if you don't want to.
All right, we'll see if she wants to
Okay,
come
maybe
on.
she'll clarify.
Yeah, little ambiguous. Okay, people want to know, how do we turn this toothpaste oil glands, which is more like a butter consistency, into a nice olive oil? You know, is LipiFlow the only way? Is there other methods? How important is that?
Well, the nutraceuticals will really help on that. And whatever type of omega-3, I would generally say you'd want one that is a triglyceride-based omega-3. And, you know, you have to watch out because you'll go to Costco or Sam's Club and they'll say 2,000 milligrams of fish oil. But you really have to look at the amount of EPA and DHA that's on the, it should be listed on the back of the bottle. So some people say, well, I use Mega Red 3, it's small, I really like it. But when you look at it, it's only got 40 milligrams of EPA and DHA. And the better ones will have probably around 1,200 milligrams together of EPA and DHA. And if it's a triglyceride form of it, you're getting a more purified form. So this is going to be harder to buy in a big box store. I have my favorites. Dr. Beck, we all have our favorite ones. I try to have one that is reasonably priced, that's made in the US and doesn't give a fish burp. But the amount of EPA and DHA in there is really what's concerning. I like having one that's only two gel caps a day. Some of them have 6, which I don't know anybody that's going to take 6 of anything in a day. So
yeah. Well, you might as well mention the brands. We're not incentivized. We don't work for the company, so it's not a big deal. What do you like, Dr. Brill?
I like the Zeavision brand that is called, it's a bad name, it's called Easy Tears. And we deal with the company for their other nutraceuticals. They're very fair. They have, you know, they ship easily. They're easy to deal with. If you have a problem with it, let's say you don't like it or something like that, they'll refund your money in a reasonable time frame. And so I try to keep it so that it's accessible and that it's not $90 a bottle or $100 a bottle. And so most people, you know, are willing to pay something for it, but it's a good product.
Dr. Beck, what's your thoughts on nutraceuticals? What do you like? And is this something that every dry eye patient should be doing?
I personally think so. I actually think that, you know, there were some studies that I had read that kind of as a nation we're a little bit omega-3 deficient. If we start to look at dietary trends, you know, throughout history, we've started to lose out on what we've actually started to digest and obtain throughout our natural diets, and especially the way that the food has changed in general, where we're not really getting to the omega-3 levels that we as a species used to. So I'm a big proponent of the nutraceuticals. You know, for EPA and DHA, just to combo back on, you know, Dr. Brill's thoughts, for those who don't know, I kind of look at it as a quick and dirty explanation. EPA being a little bit more anti-inflammatory of an omega-3, DHA being a little bit more of a neuroprotective omega-3. And the two of them working together provides a really nice combination for healing the nerves as well as calming down some of the inflammation that is associated with dry eye related issues, as well as helping produce a little bit more meibum. In addition, there's some studies that have proven that, or sorry, trying to prove that omega-6s, 7s, and 9s are also beneficial in there as well. And some of the other precursor molecules, the EPA and DHA, like ALA and GLA, found in like blackcurrant seed oil and flaxseed oil, can be beneficial too. So as far as brands are concerned, you know, my disclosure is that, you know, I'm part owner and operator of Dry Rescue, and we offer essentially a marketplace of a bunch of different nutraceuticals. Everything from a PRN is a popular brand, Hydro Eye is a popular brand, MacuHealth, Easy Tears, etc. So I kind of dabbled in a little bit of it all. As far as a favorite, because I've dabbled, I actually have different diagnoses that I tend to use different formulations for. So for patients that, interestingly enough, and this is maybe just anecdotal, I kind of want to put a study together for this, Sjogren's related patients seem to do a little bit better on the hydrolyze formula with the ALA and GLA higher, but still having a EPA DHA component in my practice. Whereas some of the more traditional MGDs do better with the PRN brand or kind of like formulas that go along with it. So it'd be interesting, hopefully a prospective study that we'll go through forward. But at least just getting something in the system to help supplement what you've got, I think can be really helpful. As long as you got a healthy enough liver and blood system to be able to process it.
Sounds good. Well, I want to thank everyone. We're nearing 2 hours here. I'm hungry. I'm thirsty, tired, sleepy.
Typical kid.
I need my dad. Well, thanks everyone for being here. Really appreciate it. If you guys like this, we may just do this once a month. And I hope you like the format, a non-sales format. We're really just here to try to get closer to the patient, honestly, because by the time you get to the office, the practice that you're going to go visit next week, it's too late. Well, it's not too late, but you should have proactively, been pursuing treatments a long time ago. So you don't want to wait till, your leg is broken. You want to do your stretches and all that stuff.
I want to commend all the patients that came on. They're very knowledgeable. It's very impressive. And I would say that you may be way more knowledgeable than the doctor. And if you're more knowledgeable than the doctor, you might not consider going somewhere else. But we all can learn. And tonight I learned a few things. And I know that if there's a large meeting, I remember Dr. Pham, a couple, 3 years ago, we all got together, like some of the specialists of the world. And we got together, I won't say in a bar, but we'll say in a restaurant. And it was during the day, and it was in Orlando at our academy meeting. And that was, and Dr. Alain Desjardins was there. Peter, you were there. I mean, we had some of the world's experts right at one table, like a dozen. And it was exciting. And Dr. Maskin was there. So Dr. Epstein, who's no longer with us, was there. So it was very, very exciting. So we all learned from each other too. And what's nice about the doctors, optometrists and ophthalmologists, that when we get together, we're not, it doesn't matter what our profession is, we're collaborative, we want to help patients. And that's, for us, it's really fun because this is such a journey for all of us, patients and doctors, and we're always learning new things. And there's things internationally that we don't have in the US, and there's things we have in the US that are hard to get in Australia, Canada, and the UK. And I think a lot of the sufferers are in those countries, at least reading on the dry eye support community. So don't be depressed by the people that are depressed on the dry eye support community that present their tale. I mean, there's hope. Anu, you're obviously an excellent example, who was very active in the dry eye support community. You helped so many people. So thank you so much for all the patients, as well as our colleagues here.
Sounds good. Well, I'm going to put, we have a line, and it's built just for this dry eye talk show that we have for all the North American people. You can always text this number. I'm happy to get you in touch with anybody. We're not going to charge you to answer an email, that type of thing. We're actually here to help. So, and then I'll put my personal email here. If anyone wants to talk to any of these doctors, I'm happy to connect you. So, well, final words, Dr. Beck, Dr. Pham, everyone, thank you for being here. We love it. So
thanks, everyone. Really appreciate it.
Yeah, it's been great. I think, Dr. Brill put it perfectly. So, not much more to add than that. Looking forward to more of these.
Sounds good. Have a good night, everybody.
Bye-bye now.
Bye.